it's a lucky day for us today. We have Dr. Hina with us. We congratulate you once again.
Thank you, sir.
And I think all of you already know she got 21st rank in AIIMS INICET November 2023 exam. The good news is, like, after like little bit of wait in the counseling process and the you can say little bit of anxiety, what she will get, what she will not get. That is the reason we tend to introduce you all to her, and she, as a very good student, was still till yesterday was studying and preparing more for the NEET-MDS 2024 exam. But today she has been allotted oral maxillofacial surgery in AIIMS Delhi. That is the ultimate dream for anybody and everybody preparing for such a great exam. So we congratulate you. She is with us at our office, BDS-2-MDS in Delhi. Lucky to have and host her today at. So we thought, why not take this advantage little bit to go beyond, you can say, her normal comfort zone and ask her to share her journey little bit on this aspect of preparation, especially INI, and what after INI she has been doing for the NEET-MDS 2024. So all to you, Dr. Hina. Just talk to your friends and you can see, yes, you can chat, you can type. She is able to see the chat as well. Just give me a second. I'll just change the screen setting rather than, yeah, this was
center.
Yeah.
Hello everyone, I'm Hina. I feel privileged to be here in front of you. I always used to be behind. It's a great feeling to be on the other side. So yeah, it feels good. I think for preparing, you should never give up on previous year question papers and repeats. बिकॉज दैट्स द थिंग, अगर कोई पढ़ नहीं रहा है, कुछ भी पढ़ नहीं रहा है, तो ये चीज तो जरूर करेंगे. यू डोंट वांट इस पे मार खाना नहीं है कि जो चीज सब कर रहे हैं वो उस पे आप पीछे छूट जाना है, ऐसा नहीं है. एंड फॉर आई फोकस मोस्टली ऑन द क्लिनिकल सब्जेक्ट्स. आई वुडंट से कि मैंने नॉन क्लिनिकल पढ़ा ही नहीं है, मुझे कुछ नहीं आता. मैंने पढ़ा तो था बट या उतना इम्पोर्टेंट नहीं दिया था मैंने. सो या
So, डॉक्टर हिना, एक बात बताओ, कैसे पढ़ना है अब बच्चों को. यू मस्ट टेल, है ना, कि हाउ किड्स हैव टू स्टडी नाउ. हेलो एवरीवन. So see the happiness, you know, you all have to be so happy, right? After the exam, you all have to get such a good rank. So Dr. Hina, अगर अभी suppose INI नहीं होता, what would you really tell कि कैसे पढ़ना है? 2 months में क्या क्या करना है?
फर्स्ट थिंग आई वुड फोकस ऑन द नॉन क्लिनिकल्स बिकॉज जैसे कि मैंने बताया, मैंने आईएनआई पे उतना नॉन क्लिनिकल्स पे फोकस नहीं किया था, तो बट नीट में वो चीज बहुत इंपॉर्टेंट हो जाती है. यू कैन मिस आउट एनी सब्जेक्ट बिकॉज हर सब्जेक्ट का एक एक इतना मार्क्स का रहता है. तो आई वुड, बिकॉज आई हैडंट गिवन इंपॉर्टेंस बैक इन आईएनआई, आई वुड हैव गिवन इंपॉर्टेंस टू दैट राइट नाउ. एंड उसके बाद थोड़ा क्लिनिकल्स भी पढ़ लेती. एंड
मतलब what would have been your strategy? First is your notes.
हाँ, नोट्स मतलब नोट्स के आगे जाना नहीं, उतना टाइम भी नहीं होता. आपको लगता है इवन इन द एट द बिगिनिंग ऑफ द ईयर, जब आप एक साल प्रिपेयर करते हो, आपको लगता है आपके पास बहुत टाइम है. मुझे भी ऐसा लगा था. बट जब आप वो जब एक पर्टिकुलर सब्जेक्ट होता है ना, तो आपको लगता है मुझे इसमें सर्व करना है. बट आप अगर एग्जाम के 1 महीने से पहले वो रिवाइज नहीं कर पाते तो वो वेस्ट ही है. जो आप वो जो 1 साल पहले पढ़ते हो, जो एक्स्ट्रा जो बोल रही हूँ मैं, तो उतना ही करना है. बिकॉज आपको उस टाइम पे लगेगा अगर मैं ऑर्थो कर रही हूँ अभी, इसमें मुझे सब कुछ करना है. बट आप एक स्टेप पीछे लेके देखोगे, आपके 19 सब्जेक्ट्स है, सारे के सारे पढ़ने हैं. उतना ही बेहतर है जितना आप पढ़ सकते हो, जो आप बार बार रिपीट कर सकते हो, रादर देन ये सब कुछ एक बार पढ़ना. उससे बेहतर तो यही है कि एक जो चीज बार बार पढ़ना
है ना.
हाँ.
So अच्छा, अगर अब हम ये देखें कि they have left, they are just having 2 months, है ना, 2 months है, and उसमें how much should they read about PYQs? PYQ कितने करने हैं? Past year जब आपने पेपर दिया, was it like a questions were coming from the PYQs?
जहाँ तक मैंने देखा है INI पे PYQs मैटर करते हैं, नीट में कॉन्सेप्ट्स मैटर करते हैं, जो PYQ रिलेटेड कॉन्सेप्ट्स, नॉट द PYQs. आप INI में सिर्फ PYQ बिना एक्सप्लेनेशन के कर सकते हो क्योंकि ज्यादातर वही रिपीट देते हैं. नीट में आई डोंट थिंक ये कर सकेंगे क्योंकि आपको कॉन्सेप्ट्स पे फोकस करना होगा rather than कि हमें ये क्वेश्चन का ये आंसर है, मैं आगे जाता हूँ. आई थिंक दैट वुड, if you're lucky it's good, if not I don't think that's the pattern they follow in NEET.
Okay. And so beta, this is one takeaway message from her. You have to revise your notes. ठीक है? There is no escape, and don't think कि ये नहीं किया, वो नहीं किया, this book, that book, nothing. You just have to concentrate on your notes and PYQ. And Dr. Hina, अभी ना बहुत anxiety रहता है बच्चों में, है ना? They are very anxious. Can you tell me how you controlled it?
During my phase, maybe anxious थी. I had joined dance class just for to have a अपना खुद का time. It helped me. You may say कि it's a time waste and all, but मैंने कहानी पढ़ी थी कि there was a woodcutter. वो initially क्या पहले दिन हाँ या 10 trees उसने काटे थे, but as time goes he this जो आउटकम था कम हो, 10 सेकेंड डे 8 6 एंड समवन आस्क्ड हिम ऐसा क्या हुआ करके. पता नहीं, मैं तो अपना काम तो उतना ही कर रहा हूँ, बट पता नहीं ऐसे क्यों हो रहा है, मेरे तरफ से इतना ही है. तो द गाय लास्ट टाइम व्हेन डिड यू शार्प द एक्स? तो लाइक मैंने जब बहुत पहले किया था तो वो शार्प करो, नहीं मुझे इसके लिए टाइम नहीं है, अगर मैं शार्प करूंगा तो ये नहीं होगा. बट इसलिए लाइक यू हैव टू फाइंड एटलीस्ट 1 घंटा. आपको लगेगा कि मैं it's not like I'm wasting my time and all that, but आप अगर वो anxiety उसमें भी आप तो waste कर रहे हो, उससे अच्छा तो do something productive, do something physical, something. I feel that's important, that's also important.
अच्छा बेटा एक बात बताओ, let us talk subject wise. ठीक है, इस stage पे subject wise is very important. Anatomy से start करते हैं. How one should prepare for anatomy? Anatomy के questions कैसे होते हैं, कैसे आपने prepare किया था? Because you were preparing for NEET, है ना? You were still preparing, so we can assume कि you have done anatomy, है ना?
हाँ.
तो कैसे पढ़ा?
मैंने सबके लिए एक ही follow किया था, the notes, जो कुछ notes दिया था, and उसके बाद question papers and anything related to PYQs वो देखती थी, and that's it. वही बार revise करना whenever ऐसे time मिला तो.
And how many hours were you putting in?
Maybe 8 to 10 hours roughly.
8 to 10 hours बस?
हाँ.
उसके बाद
AIIMS result आने से पहले like how many hours?
It doesn't matter about the time, कितना time, it matters the quality. It's not, it's quality not the quantity.
one more thing जो बच्चों में हमेशा they are very confused कि आप intern हो या आप drop आपने किया. See, drop out is not a word, you are a chance taker, है ना? So you are not dropping something, but suppose you are intern person, can you get this rank?
I think more than anything, it's your belief in yourself. So if you believe that you can. If you believe you can't. You can't. True.
So you all through the preparation you must be having some subjects जो जिनसे डर लगता है या जिनको like you call as problematic subjects for yourself. So how in the last days you were coping with those? Like how any special subject you want to mention, or how you overcome that fear of that particular subject?
वो बार रिवाइज करना तो
revision is the
ultimate. वो just इनिशियली ऐसा लगता है. यूजुअली कुछ सब्जेक्ट्स जैसे सर्जरी, बायोकेम हमको बैक इन यूजी डेज में नहीं करवाते सही में, तो वो एक डर बैठा रहता है कि मुझे नहीं आता, ऐसा बैठा रहता है. बट जब क्योंकि आपके आप में यू हैव दैट दोस्त, बट आई थिंक नितिन सर ने खुद बोला था, आई नो कि आपको यूजीस में पढ़ाते नहीं इसलिए मैं एनाटॉमी से पढ़ा रहा हूँ करके सर ने खुद बोला था. तो आई थिंक आपके तरफ से भी था वो, एंड अपने तरफ से भी इंटरेस्ट वो आ जाता है व्हेन द टीचर्स आल्सो शो इंटरेस्ट. इट्स क्या बोलते हैं, सिम्बायोटिक. दोनों, यू शो इंटरेस्ट, वी आल्सो शो इंटरेस्ट, यू आल्सो शो मोर इंटरेस्ट, ऐसा हो जाता है.
So basically, in these last days of preparation, you were already done with the classes.
Yeah.
You had made the notes.
Yes,
You were
sir.
revising your notes on regular basis.
Yes, sir.
You were solving PYQs.
Yes, sir.
You were attending quiz.
Sometimes the जो क्या बोलते हैं,
Basically solving questions.
Yeah.
What about test?
Tests sometimes like देती थी सर.
But दिया है, sooner or later you have.
Yeah,
given.
I have given. May not be on time, but I have given.
And one question which I am getting every day from student is, test में marks कम आते हैं तो how you overcome that part?
मैंने जब भी मैं टेस्ट देती थी, आई हैड ऑलरेडी अपना दिमाग बना लिया था कि इसमें जो मार्क्स आते हैं इट्स नॉट इम्पोर्टेंट. बहुत लोग जहां तक मैंने देखा इसमें कर लेते हैं टेस्ट में, क्योंकि वो बहुत कंसाइज होता है, सब्जेक्ट होता है, जो लाइक यू कैन डू दैट नीट में या एम्स में, बिकॉज इट्स अ बिग फील्ड, यू हैव टू रिवाइज एवरीथिंग. तो मैंने यही रख के दिमाग में टेस्ट देती थी कि इसमें जो भी मार्क्स आए, बट इसमें जो गलत क्या है ये मैं वहाँ एग्जाम में नहीं कर लूंगी.
Exactly. So basically, test is a tool, है ना? Test is a tool. We don't have to worry about the marks.
Yeah. We take it initially. We take it as a test to, tool to test ourselves. But that's not how I think the approach.
कि अगर कम मार्क्स आ रहे हैं तो we are weak. नहीं, ऐसा नहीं है. You just have to improvise with every test. ठीक है? Okay. Very good. So बेटा, the two messages जो मुझे आपके preparation से समझ आए हैं, revision, right बेटा? Everyone, revision is the key. And second, every 19 subjects have to be completed for NEET. Done? Any questions बेटा you all have about any subject to her? Then you can ask. How much was your attempt? कितना था?
मैंने चार छोड़े थे.
नहीं, अटेम्प्ट मतलब आईना में क्वेश्चंस कितना किया था?
वही 4
क्वेश्चंस छोड़े थे.
ओके, 4 क्वेश्चंस छोड़े थे.
196.
So it was a high attempt. How to revise in last 2 months?
I think अभी कुछ नया नहीं करना चाहिए, जो पढ़ा है उसी को.
So Dr. Yasin and everyone, I want all of you to revise your notes very nicely. Everything that you have done, you have written in your copy should be learned and revised. ठीक है? एग्जाम में अगर ऐसा, बेटा एक बात बताओ, I always tell them paper is going to be easy. है ना? पेपर इजी होना है कि मुश्किल होने वाला है?
वो अपनी प्रिपरेशन के ऊपर.
Exactly. It depends upon how much you have revised.
And अगर डिफिकल्ट होता है, आउट ऑफ बॉक्स क्वेश्चन आते हैं, इट्स डिफिकल्ट फॉर एवरीवन. ये हमारा जो BDS में जैसा होता है एग्जाम, ऐसा नहीं कि वो उसका 94 आया, मेरा 78 ऐसा कुछ आया, मेरा 63. एवरीवन, सबके लिए डिफिकल्ट होगा. अगर इजी आएगा तो सबके लिए इजी आएगा.
मतलब इट इज अ टेक्निक बेस्ड एग्जाम.
मतलब माय रैंक आल्सो डिपेंड्स ऑन समवन एल्स प्रिपरेशन आल्सो. तो you don't have to at least जो previous year questions जो करते हैं ना, you can't take a chance on that. Previous year.
So previous year questions beta, are you all doing or not? She prepared, Dr. Neha, मतलब कि she was a chance taker, so she was preparing at home, है ना? So that doesn't matter. Matter क्या करता है बेटा कि she completed her 19 subjects.
See, right? You all know, all those who are attending this live session on app, you all know she was amongst you in the same WhatsApp group,
yes,
in the same course,
yes,
asking similar questions during live class, asking same doubts during doubts class. So if she is the person who is sitting on this side of fence now, next is you only.
So you all can come. Today's session was for that only. We requested her that, bhai, you have to,
rather than going
rather than
Zoom meeting and all, showing a propaganda of Dr. Hina getting a rank, crown.
Yes.
She has achieved what she believed in. She has achieved the highest level. Everybody aims for AIIMS Delhi. Amongst all the AIIMS also, AIIMS Delhi is considered as the dream seat.
And she was with you till yesterday. Okay, so that is the one motivation. She was with you till yesterday. Today she has got a seat. So that means, if she can do it, anyone can do it. है ना?
Yes,
कर
ma'am.
सकते हैं ना?
हाँ, ma'am.
हिना, were you very intelligent?
No, ma'am.
Very, मतलब कि out of the world होते हैं?
No, ma'am.
No.
Not like that.
So were you like, मतलब कि what would you say कि exam is for only those people के भाई जिसने अच्छी तैयारी की है या जो बहुत ही intelligent है? क्या है?
Discipline, who are
Yes.
discipline, consistency, more than intelligent.
Yes. And even if you are sad, you will study.
Yeah.
है ना?
Yes.
You are sad, you will cry and you will study. Will that
Yes,
be the
ma'am.
case?
Yes, ma'am.
है ना?
One
Yes,
question is there. Did you rely on MCQ books?
I think the focus should be more on concepts. Of course, you can take MCQs because आपको जानने हैं कि previous years questions या कैसे आ सकते हैं, कैसे वो जो options रहते हैं, ये आप सिर्फ concepts में पढ़ेंगे, आपको वो उतना you're not putting yourself out there. वो जो like how confused you'll be between two options and all that. So for that, yeah, you need MCQs book, but yeah, अगर concepts clear है तो you will do it.
So बेटा again देखो जितना मुझे समझ आया ना, she has really done her notes. ठीक है, चाहे वो कहीं के भी notes हैं, she has revised them and she has worked on concept building. Like I always tell you, है ना, diabetes में से अगर question आएगा, if you have read it, you will be able to really do any kind of questions. ठीक है, and बेटा pharmacology, medicine, how should they go about it? Because they are the trouble subjects, है ना?
मैम अगर मेडिसिन फिजियो आपका फॉलो करेंगे तो हो गया.
Pharmac है जैसे OPAT है, they are the marks, no, they are the major marks contained.
Revise, ma'am. Okay, Pharmac आपको लगेगा कि it's a boring subject, dry subject, but if you want to get there, if you want to get AIMS, if you want to get into NEET,
Pharmac आनी चाहिए.
हाँ, आनी चाहिए.
Even all dental subjects, all questions were related to notes only in the INI.
Yes.
It won't go much beyond that, like.
And if it goes beyond also, like सबके लिए beyond, like,
सबके
it's
लिए,
not just for you.
Yes.
It will be the toughest question. I always say it.
So basically, Dr. Hina आपने एक बात बोली थी कि PYQs जो होते हैं, if you do it wrong, you are out of the race.
Yes.
है ना?
Yes.
So बेटा, if you do what we have been teaching you again and again, ठीक है, quiz में या फिर PYQ में या कहीं पे भी, if you do that wrong, you will be out of race. ठीक है? Because 5,000 kids will do that right. है ना?
Yes, ma'am.
They will do it right, the PYQ, so don't miss them, right? Next question, next level question will depend upon concept.
Yeah, yes, ma'am.
Okay, any other question, Mira? Last minute tips.
जाते जाते.
हाँ, Dr. Adish, अपना इसको Dr. Adish ने पूछा, how much time did you take to prepare for that rank?
It took me like मैंने 10 hours पढ़ती थी almost.
Time and I think he is asking about months. कैसे?
Months. मैंने मई वाले पे उतना फोकस नहीं किया था. मैंने सोचा मई के बाद ही मैं अच्छे से तैयार करूँ.
Because your syllabus might not have been over. No?
अच्छा, Dr. Hina,
she started journeying with you guys only, I think, early this year or.
Yes.
So आप imagine करो ना, if you started in January, May would have been too early for her to. She gave exam maybe, but yes, definitely November was. And NEET was the target. November came on the way with full preparation, good revision, and it's the result which speaks out more than her preparation now.
अच्छा, Dr. Hina, एक बात बताओ. You are preparing for 10 months. Like all the doctors, all your friends are working for 1 year. Since 1 year, they are preparing. वो 1 year matter करेगा ये last 2 months.
Last 2 months.
Last 2 months. So yeah, बेटा, this is what I call, the khulasa. So if you have not studied for 1 year.
It's like what you say, marathon and sprint.
I want, yeah.
Sprint marathon में like जो आगे starting में आगे भागता है, जो first है, जरूरी नहीं है last में भी वही पहुंचेगा. तो
it's the final lap which matters. Yes. Like how fast you cover up the final lap.
अगर इन्होंने अच्छे से किसी ने नहीं पढ़ा है, so if 2 months, 60 days they put in, can they clear it?
Of course they can.
Of course. So of course you can. Okay, बेटा. अच्छा, ये देखो ना. What should you do when you are very demotivated?
It's a phase which everyone goes to. You have to cope up with that. Something you just study. When you know that you have a goal, this demotivation is just like a small thing. You just get over it. Maybe cry for 1 or 2 hours. But ultimately, that's the goal. You know what your goal is.
No, she also had phases. She was also not always happy. She also left studying, but just before the exam, will you leave studying if you are demotivated? If you are feeling negative?
No.
If suppose your mind is telling you I can't do it, will you stop studying?
No, ma'am.
No. So beta, one thing is very clear: don't leave studying. Okay, even if you have not prepared till now, 60 days is a game changer. Okay. Acha, you were only preparing or doing clinic also?
No, I was only preparing.
And very interesting story for that also, because her mother did not allow her. She wanted to go, but her mother said, no, I will give you the money and you just keep on studying. Right? So she did want to go, but her mother stopped. Right?
Yes, ma'am.
Okay. Did you refer any other sources better?
No, I think whatever they given BDS-2-MDS, it's more than enough for
any extra book for any subject that you did. You can tell them.
No,
It's okay. You be truthful to them and tell I did this extra.
Apart from your notes, I have taken dental triplet book.
Okay.
And they have
that's MCQ book.
Yeah, MCQ books.
Okay.
I was heavily dependent on them on that book for previous year questions. And yeah, that's it.
See, it's like dental triplet, and likewise there are dental pulse and all. It has mainly past papers of AIIMS. It covers up. So again, the story revolves around your concepts and past year papers, especially for INI. Even like she said, she is very true. NEET will not have exact copy paste of PYQ, but the questions, the topics, the theory, the concept will revolve around those PYQs only, at least for around 75 to 80% of paper. This I can assure you.
Beta, see, if you do many books and you don't.
For all those who cannot see me, I am sitting behind my laptop.
Of course, they know. Okay. Hana, beta, so if you don't know your notes and you run after other books, beta, loss ho jayega. Okay? Why? Because your 70% paper is going to be from notes. Okay? It is going to come from there. And rest from your PYQs, PYTs, everything.
You know how much a top ranker scores usually? It is about 75%. The top means top 50, maybe top 25, even up to top 100. And top 500 students, their score revolves around 67% to 75%. So if you believe that your notes will give you around 80%, 85% kick, itna bhi kar loge na, you are already through with it. Supplemented with past paper, supplemented with extra dose of questions through test and all, you are covering 95% of NEET paper. You attempt 95, you do 10-15% mistakes, you are a topper. That's the formula every student has been doing for last many years with us. नहीं समझ आया तो I'll explain it बाद में.
So beta, is it doable?
Yes, of course it is doable.
Now they don't have to waste a single day.
Yes, ma'am.
Right? Yes, and it is doable. You have done it.
Yes, ma'am.
Yes, ma'am. Beta, she has done it, and again I'm saying till yesterday she was with all of you preparing. Okay? So if she can do it, she of course did a lot of hard work, so can you. Okay, you want to say anything to them? Did you go back to textbook, beta?
No, I was completely dependent on your notes. It was more than enough. अरे वही करने का टाइम नहीं मिलता लास्ट में. आप टेक्स्ट बुक की बात करते हैं, जो आप स्टार्टिंग में करते हो, लाइक जब टाइम रहता है, जब आप स्लो जाते हो उस टाइम पे, जनवरी के टाइम पे, वो आप रिवाइज नहीं कर पाते 2 महीने पहले, तो उसका वैल्यू ही कुछ नहीं रहता. तो उससे अच्छा आप जो सिखाया है वही अच्छे से पढ़ो, ताकि वो जो ज्यादातर आप वही देते हैं जो कॉन्सेप्ट रिपीट हुए हैं, जो नोट्स आप बनाते हो, तो वही पढ़ोगे तो उसी में हो जाएगा.
एंड बेटा लास्ट डे पे क्या करते हो एग्जाम से जस्ट 1 day before? What did you do?
I just went through the previous year questions just like that. I didn't go through any explanations जो previous year.
And on that day beta, were you able to answer everything? You were still forgetting?
Yes, I was forgetting.
Yeah. So beta, you will forget even when you go for exam. Okay, you don't have to lose confidence. Okay?
Did SR-ship papers help in INI-CET?
I had done SR-ship papers.
Yeah, SR-ship has a value in INI, but don't depend them for NEET. Abhi aap sab chhod do, like what is INI is gone. NEET has a different story to tell.
तो अब अगर आपको करना है तो NEET के लिए if you were preparing, you were putting मतलब focus on which 4-5 subjects?
As I said, मेरे non-clinicals weak है, तो I would have given importance to them क्योंकि
medicine, physio,
pharmac, biochem, microbiology,
okay.
And NICE मैंने किया था because
so basically you have to know your weakness.
Yes.
ठीक है, it can be different for different people. ठीक है, सब किसी का ortho difficult है, मुश्किल है, so do that.
Yes.
ठीक है.
Yes ma'am.
Okay. Anything last you have to say? कुछ भी बोलो उनको कि so that they realize they can do it. You can do it better. Seriously, me, you can do it. It is not something very difficult. It is actually a doable paper. चाहे वो INI है, चाहे वो NEET है, and NEET is more doable. Yes. INI में still luck factor is there.
Yes. Yes.
But NEET में क्या होता है? NEET में it is doable.
Doable.
है ना? Lot of rankers are there.
Yes, ma'am.
है ना? So say something to really make them happy, and they can study now after this.
It's not too late. It is still the ball is still in your on your court. You can it can be a game changer, provided you make use of it. Make use of the remaining time.
Yes, provided you study. So now, beta, takeaways क्या है? One thing, have confidence, like she had in herself. ठीक है? Have confidence, and you have to revise your notes. And third, you have to keep studying for the next 60 days. And the seat is going to be yours. You are going to come and sit here. Okay? Chalo, with this promise, go and study. Go, beta.